But along here to your health, Southern California and several southwestern states that are reporting record-breaking numbers of COVID-19. And to help stop the spread and protect people during the pandemic, California and more than 21 states now require that face masks be worn in public. Joining us via Skype this morning with tips on how to stay safe in extreme heat, we have emergency room physician Dr. Henson from Dignity Health St. Bernardine Medical Center in San Bernardino. Doctor, good morning to you, and thank you for being with us.
Good morning. Thanks for having me.
So, we have this combination now of we have this extreme heat, we have a spike in cases. And so just right off the top here, what do you say? You have folks that are totally amenable to wearing a mask. Even though it's hot, they've got their mask on and you see them out and about. But you also have folks that are still not so, they're not fully committed yet to wearing masks, despite the fact that it's for public safety. What do you say about how do we navigate this and the importance of this even during the heat?
Well, it's difficult whenever it's hot outside to be wearing something over your mouth, obviously. You don't have to wear a mask all of the time. You got to wear a mask whenever you're within 6 feet of people, whenever you're not able to socially distance, especially. So one thing that could be difficult, too, is that, sometimes people sweat. And so whenever the mask becomes full of water, you got to remove it and put a new mask on, make sure they stay clean. And wear it when you're around other folks. That you're really protecting other people and yourself.
Dr. Henson, talk to us about the safety of exercising outdoors. And we hear all this stuff about the virus being aerosolized and that it hangs in the air for 8 minutes. So if you're bike riding, if you're jogging, if you're skateboarding, do you have to wear your mask during exercise outside?
So I think that's a case-by-case basis. If you're doing martial arts with other folks, you probably need to wear a mask. If you're jogging by yourself, I don't think you do. There's no better place for air exchange than outside. Outside, you've got wind, you've got a massive amount of area for those droplets to dissipate. And I don't believe that you need to wear a mask whenever you're riding your bike by yourself, when you're jogging. In fact, I think it just makes you hotter.
Does the sunshine eradicate the virus if it's aerosolized in the air?
It should, yeah. So according to the CDC, they did all these studies with UV light, and the virus dies so much quicker in the heat and also with UV radiation.
And what about folks getting outside? Because, people feel like it's hot, I want to stay inside. But it's also health-wise. We do need to get out. We do need to get the fresh air. We do need to be in the sun. We can't just stay inside and limit our exposure that much.
Absolutely. Whenever you don't go outside, you don't get vitamin D. And so we've got to go outside. It's also good for your psyche to be outside. We live in California, and the beautiful part of that is we get so much sunshine, and so we don't get the blues from all the clouds and rain. However, I would recommend, especially during these heat waves, going out early morning, late evening, and trying to avoid the real heat of the day. And if you do need to go out the heat of the day, drink a lot of water, use a good sunblock, and keep a good handle on your body. So if you start to get headache, nausea, vomiting, abdominal pain, those are reasons to get out of the sun, get yourself cooled down, make sure you're drinking lots of water.
Yeah, just common sense on stuff like that. So Dr. Henson, we're hearing, that children aren't as vulnerable, and yet then there are other reports that there's this inflammatory disease, much like Kawasaki disease, that's impacting our kids more and more. So I want to know what you're seeing, because when I'm out and about, on our streets, running, jogging, biking, I see a lot of kids with their families not wearing the mask. So what say you about kids and their susceptibility?
Kids are susceptible to the illness just like everyone else. My experience has been that we don't see as many kids that are sick with this. So if they get sick, they get a fever, runny nose, cough. That's not to say that you don't have cases where children are affected deeply. But most of what we're seeing is the elderly and folks with a lot of comorbidities that really are affected by this illness the most.
And you see a lot of people right now, too, doctor, holding off about going to the doctor's office for like a routine checkup because they're just so worried and concerned. So can you just speak to us about that? And should people be concerned, or should they stay at home and not go to the doctor right now?
No, I don't think you're at any higher risk going to your doctor's office than you are going to the shopping mall or anywhere else. People have got to take care of their health. When this pandemic first started, we started to notice that we had almost no patients in our emergency department. And we were like, man, where are the heart attacks? Where are the strokes? Where are the people that need to see a doctor? You're much more likely to be hurt by not seeing your doctor than you are by staying home. you're much more likely to be hurt by staying home than not seeing your doctor. You've got to take care of your health. And, wear a mask. Most doctors' offices that I know of, especially here at our hospital, we socially distance. We have people wear masks. You're just as safe here as anywhere else. You've got to take care of your health.
All right, doctor, we thank you very much for your work that you do, and thank you for being with us this morning.
Stay safe yourself.
Thank you for having me.
Yeah. Thank your team.
You as well.
Thank you.